My name is Denise Brennan, and this is the opioid epidemic, a public health emergency. The United States is in the midst of an opioid epidemic. There's been a drastic increase in overdoses and opioid misuse in this country. More and more people are becoming addicted to prescription pain pills. Many people who started taking opiates started out with a legitimate need for relief of their pain, perhaps following a surgery that was intended to enhance their quality of life. About 90 miles north of Phoenix, Arizona, lays an area known as the Verde Valley, known for its picturesque views. In the last 2 weeks, there have been 5 local opioid-related deaths. For this presentation, I have interviewed Battalion Chief Larry Dawson, who has been a firefighter and EMT since 1985, seen in this image, second from the right. Sergeant Garth Braxton Johnson, who began his law enforcement career in 1999 in Phoenix, Arizona. He has worked in narcotics for several years of his career and has a very unique perspective on the opioid epidemic. And finally, Patricia Miner, a licensed clinical social worker who is a therapist at the new medication-assisted treatment program being offered at Spectrum Healthcare in Cottonwood, Arizona. When asked how she sees the impact of the opioid epidemic in her role, Patricia Miner states, "How do I even put that into words? Everywhere, everyone seems to know someone struggling with this issue. Families are being ripped apart. Women are losing their children, their babies. The police feel they are in a losing battle by the time they become involved, and they are arresting people for illegal drug use, like heroin. They feel there's little they can do. The fire department reports that doctors are giving opiates out like candy with little to no education to the patient." Opioid misuse does not discriminate across socioeconomic status. Those affected are equally represented amongst the wealthy and those living in impoverished neighborhoods. Cottonwood, Arizona is a growing blue-collar working-class neighborhood with a large population of retirees and families. Those affected range from teenagers to the elderly. The fire department reports a shocking statistic. The largest number of calls they have for accidental overdoses are in nursing homes due to staff error. The stigma attached to opioid misuse is a challenge. Known as the junkie's drug, many become convicted felons. They have drug charges on their records. They become homeless. They lose their families, their identity. Once they become sober, they are without effective coping skills. The police and fire departments had difficulty identifying strengths for this population, but the social worker was able to clearly identify that her clients have a tremendous strength, willingness to learn, resiliency, perseverance, and an ability to adapt. They recognize how hard their battle is. They continue to fight for the life they had, fight for the life they want. The fire department is able to provide Narcan to save someone's life in the event of an overdose. They are required by law to fill out a fact sheet containing information such as what drug was the person on, how long were they on it, and who is their prescriber. Spectrum Healthcare in Cottonwood, Arizona has just launched a medication-assisted treatment program. Clients will be prescribed Suboxone. They will have family, group, and individual therapy that will include education on opiates. They will learn effective and healthy coping skills for dealing with past trauma and life's challenges. Family groups will provide education to families on opiate addiction and warning signs, and will create a venue for asking questions and talking with others who've also been affected by opiates. Local agencies describe their relationship with probation and particularly drug court as controversial, and they have mixed feelings about the drug court program. They find themselves asking, is this helping prepare the clients for life's challenges and holding them accountable, or is this simply punitive? Recidivism rates are high. Shame is high. The agencies interviewed that they come into contact with the same people all of the time. According to Sergeant Braxton, what keeps people hooked on opiates is the fear of going through opiate withdrawal, also known as being dope sick. These symptoms include agitation, cramps, diarrhea, depression, physical pain, insomnia, nausea, and anxiety. This fear outweighs all the consequences, including losing their family, their children, and facing jail time. MatForce is a coalition in Yavapai County comprised of community members, including law enforcement, businesses, schools, youth, parents, faith-based organization, government, media, and even healthcare, all with a common interest to reduce drug use in Yavapai County. Another local resource is Spectrum's Medication-Assisted Treatment Program. It all comes down to the mighty dollar. Every agency interviewed stated that the one thing their agency needs to combat the opioid epidemic is funding. Funding to provide life-saving equipment, programs such as clean needle exchanges, dump the drugs, funding to provide medication-assisted treatment, and funding to provide education. The intervention that I propose is a monthly meeting to include law enforcement, healthcare professionals, educators, the general public, doctors, MatForce member, Spectrum Healthcare, and social workers to devise ways to generate funding for education and to educate each other. With the prescribers on board willing to say that there's more that they can learn about treating pain, about opiates, about opioid misuse. With their willingness to educate themselves and their patients and follow the guidelines set forth by the law, the opioid epidemic can see a tremendous impact for the better. As a former local 911 dispatcher, I feel it is the positive pre-established relationships that I have with each agency and their genuine desire to help and not punish is what has made this presentation effective. Perhaps it is those positive affiliations that I have with those agencies that have hindered this presentation. Perhaps it was hindered by the strained relationships between adult probation, drug court, and the other community partners. This presentation would have been much more thorough and informative with information from adult probation. This process was a roller coaster of excitement, disappointment, shock, fear, and hope. I did learn that the community partners genuinely want to help those affected by opioid misuse. The inherent dignity and worth of each of these people is valued, and people have not given up hope.